Hey guys, welcome back to the EMS Quick Guide. Today we're talking about a medication called Furosemide or Lasix. Now this drug is a loop diuretic. It blocks the absorption of sodium and chloride in the proximal and distal tubules and the loop of Henle. Okay, now this is basically happening in the renal system, in the kidneys, and understand that this is basically increasing urine output. Not only does this increase urine output, but it can also act as a vasodilator, which will reduce preload in the heart. Now, what are some indications for this medication? Pulmonary edema, heart failure, hypertensive crisis. Now, typically the drug dose for this medication is 0.5 to 1 milligrams per kilograms over 2 minutes, and that's an IV push. Now, follow your protocols. For example, my protocols is I give 40. I've seen a lot of protocols give 80. So, like I said, follow your protocols when it comes to dosages. The pediatric dose is going to be 1 milligram per kilogram. And remember, this is a slow push of at least 2 minutes. If you push this drug too quickly, you can actually cause tinnitus or some ear problems. Now, some contraindications for Lasix: pregnancy, hypersensitivity, hypotension, hypovolemia or shock, and even those patients that have sulfa allergies should be contraindicated to be given this medication. Now remember, we said it's a 2-minute push. Now, how long does this actually take to work? Its peak effect is going to occur anywhere from 20 to 60 minutes after pushing this medication, and it's going to last in the body from at least 4 to 6 hours. Now, of course, with most medications that we give, there are some adverse reactions that might happen. Okay, one might be dizziness, hypovolemia, vomiting, nausea, hypokalemia, hyperglycemia, may cause orthostatic hypotension, and like I said before, it can actually cause some ear problems if you push it too quickly. Now, how am I going to know when to give this medication? For your patients that are suffering from edema, okay? Now we know that there's right-sided heart failure and there's left-sided heart failure. Remember, pre-oxygenated blood comes into the right atrium. If your right side of your heart is weak and it's failing, that blood is going to be backed up starting from your right atrium, so it's going to go back into systemic circulation, and a lot of that blood is going to pool all the way down into the feet, and that's typically when you're going to see that pedal edema. Now, if it's left-sided heart failure, remember, it's going to back up out of that left atrium, and it's going to back up back into that pulmonary artery and back into the lungs, and then that's when we're going to actually have rails or crackles when we listen to lung sounds. So always do a detailed physical assessment, get good lung sounds, and that's going to dictate when we're going to be giving this medication. Now, this is a good medication that we carry, but understand here in the pre-hospital setting, you're probably not going to be seeing many effects after giving this medication, especially if your transport times are short. And remember that your patients that are on Lasix are going to have an increased urine output, so be expecting them to have to use the restroom, and hopefully you'll have some sort of way of allowing them to do so. Alright guys, well, I hope you enjoyed this. Like, subscribe. If you have any questions, please feel free to ask, and I will see you next time.